Hi, everyone, and welcome to the Wise Body Podcast, where we talk about eating disorder recovery and all things body. I'm your host, Dr. Sarah Hughes. I bring 20 years of experience as an eating disorder therapist, and I've worked with hundreds of clients to feel more empowered and connected to their body by tapping into the wisdom it holds. I'm so excited to keep learning with you as we navigate the windy path that is recovery. So let's get started. Hi, and welcome to another episode of The Wise Body. Today, I thought I would come on to describe the roles of a care team. So if you're new to treatment, really any level of care, or you want to know more about the roles of a care team or who to add to your team so that you can have the best recovery possible, this episode is for you. I often get asked things like, when should I add a dietitian? When should I add a psychiatrist? What's the difference between a psychologist and a psychiatrist? What's the difference between a licensed social worker and a licensed marriage and family therapist and a licensed professional counselor? It can all be a little confusing. So I wanted to briefly break it all down for you here. Firstly, when you are in the outpatient level of care, this is like your standard weekly therapy. You get to choose who's on your care team. When you're in treatment, inpatient, residential, PHP, or IOP, your team is assigned to you. Your team can change, but it's rare. Things like if a provider on your treatment team leaves the program, that might be an example. Or if you are not feeling connection with one of your providers, and if you provide robust rationale to change that provider, it may be honored, but it isn't typical. So back to your outpatient care team. With any of your providers, I strongly recommend finding those who have eating disorder experience, as they're more likely to know how to talk about your eating, how to be sensitive to eating disorder behaviors, and just in general, the right questions to ask. So in today's Wise 5, I thought I would break down the 5 roles for you to consider for your care team. Let's first start with your therapist. It can be really hard to find someone who specializes in eating disorders. It can be really hard to find someone that you connect with. But all too often, I hear from clients this scenario, that they have had a therapist, maybe even for years, but this therapist didn't have a background in treating eating disorders, and then therefore the eating disorder was sustained. So that can be a problem. And sometimes the eating disorder gets missed for that reason. And it's not necessarily anyone's fault. It just hasn't come to the forefront. And when it does, ethical practice would be for a therapist to refer out if it feels like the eating disorder is out of their scope of practice. And that happens quite a bit, I would say. A therapist can be a psychologist, a licensed social worker, a licensed marriage and family therapist, or a licensed professional counselor. So what's the difference? A psychologist is someone that has their doctorate. So typically there are 2 doctoral degrees that we see in the field of psychology. You can have a doctorate of philosophy in psychology, which is a PhD in psychology. That's what I have. Or you can have a doctorate in psychology. It's a little nuanced. There's not much difference. A PhD has been around longer. A PsyD is a newer degree, but also very much well recognized and just as much school. So the difference between a psychologist and, say, a social worker or an LMFT or an LPC is years of school. So someone that has their degree in social work or marriage and family or counseling they have a master's degree. That's typically 2 years of grad study. Someone with their doctorate, it's more school than that. And they might also have a master's degree. So for me, I have my master's degree and my doctorate. So I completed 2 years of grad school at Northeastern in counseling psychology and got my master's degree. And then I got my doctorate at the University of Miami, and that was another 7 years. The difference is years of school. I just want to say a little side note that just because someone has more school doesn't mean that they're a better provider. It just means that they have more school and maybe more academic experience. They might not have more experience with eating disorders. So I just want to make that distinction that some of the best therapists that I know have their master's degree, and they are not better or worse than someone with a doctorate. Just wanted to put that in there. So a social worker has their degree in social work, marriage and family therapist has their master's in marriage and family, and an LPC has their master's in counseling. They're all very similar. They overlap. Someone that studies social work, I would say, has a broader perspective, has a broader course of study. They study groups of people. They study social justice. Someone with their license in marriage and family, that is more of a niche, right? They're studying couples. They're studying families. They're studying the dynamics between couples and families. An LPC is also more of like a general psychology degree. And I have my LPC. I'm licensed in counseling in the state of Connecticut and Colorado. So after one finishes their master's degree, typically 2 years, then they often have to work for 2 years to accrue hours for licensure. Then they can apply for the license in the state in which they reside. So each state is different with their requirements in terms of like how many hours of clinical supervision one might need. It could be like 1,500 hours. It could be 2,000 hours. Generally, it's a lot. Generally, it takes 2 years. So after you complete school, you're working for a couple of years before you are licensed. And that license just means that the state recognizes that you've completed all of their requirements of that state. And typically it's just hours of clinical work and supervision. So the most important thing with your therapist is that you feel connected to them, that you feel like you can trust them, that you feel like they have knowledge and expertise in the area in which you need help. Therapists often are the lead collaborators on a care team too. So, and that makes sense because if you're meeting, let's say you're meeting mostly with your therapist every week, they're most informed of what's happening and any changes that are going on, and can then communicate with your dietitian and doctor often. Recovery coaches are often primary collaboration lead as well, so they may take on that role as well. And I'll get to recovery coaches at the end of the episode. But that's a little bit about an eating disorder therapist. Several therapists may not take insurance. I'm finding this more and more common. There are therapists that might be covered by your insurance, but I'm finding more and more that they are not. And I think therapists have their own reason for that. The reason why I don't take insurance is because I've worked in several programs over the years, and I've worked with insurance companies, and I've had to really advocate and fight on behalf of my clients. And in my private practice, I don't want to do that. I would rather devote my time to the therapy and collaboration. But I understand and totally value the need for using insurance. And if you do need to use insurance, You can go on your insurance website and search providers that way. Sometimes they're listed by specialty, or you can old school call your insurance company and request 3 names within a 30-mile radius, those that specialize in eating disorders. Then I would cross-reference, call those, say, 3 therapists and make sure that they do, in fact, specialize in eating disorders and also take your insurance. Because sometimes therapists may have taken insurance in the past and then they no longer do. Another option I just want to share, and this is something that I provide for my clients, which is even though I don't take insurance and considered an out-of-network provider, I can provide what's called a super bill that you can submit to your insurance. And basically, a super bill is like a receipt of therapy services. So over the course of a month, it'll give like the total number of sessions and the total amount paid. And then the insurance company can decide if they're going to reimburse for that amount or part of that amount. And in my experience, some of my clients have had really great reimbursement rates, upwards of like 80%, but that is not guaranteed. And so I would call and ask your insurance company if you do want to work with a provider that doesn't take insurance. You can see what their reimbursement rate is for an out-of-network provider. And it's all different. It just depends on your insurance and your insurance plan. The next role on your care team to consider is a registered dietitian. So I think that a registered dietitian, someone that specifically works with those with eating disorders, has a really hard job because a registered dietitian is poking at the eating disorder very specifically because they are talking about food. Probably if those sessions are every week, they're talking about food every week and specifics about food, not about numbers, calories, weights, or anything of that nature, but talking about things to consider in terms of a meal plan, making changes around your eating, what you're eating, your pattern of eating, your flexibility around eating, meaning like flexibility around food items, flexibility around your schedule of eating. And that can be really hard. And an eating disorder is going to meet that often with a lot of resistance. And so I often bow down to my registered dietitian friends because they often have a really hard role in challenging the eating disorder and coming up against the eating disorder in every single session. Again, a registered dietitian, that's someone that has a license in nutrition. So they are recognized by the state in which they work by having a license. So they've completed school. Typically, it's a couple of years of nutrition, grad school. And then they also need to apply for licensure and have preclinical licensing hours and then apply to the state. And only then are they recognized by the state as being licensed once they meet all of those requirements. So that's pretty similar with a therapist and registered dietitian in terms of their license. It's state to state, and those requirements are state specific, I would say. And that is also why if you are meeting with a therapist that is licensed and they're using their license to treat you, they can only treat you within that state. I think during COVID, there were some exceptions made to that. The next person on your care team could be a psychiatrist. So a psychiatrist has their MD, their medical degree. A psychiatrist is someone that prescribes medication. So a psychologist cannot prescribe medication, but a psychiatrist has their MD and they can prescribe medication. A psychiatrist might be a good idea to add to your care team if you are taking psychotropic medications, often if you're taking more than one, or if there's any sort of complications with medicine in your past, or you just want a psychiatrist that specializes in medicine and knows about medicine. A psychiatrist may do a genetic test to see, which is like a cotton swab on the inside of your mouth to test how you metabolize medications, meaning which medications are going to work best with your body. And I'm seeing that more and more because so often people waste a lot of time trying to find the right medication. Also, if you know a family member, usually like a first-degree relative that is taking a medication and it's working, chances are it might work for you, but it might not. I'm not saying that's a guarantee, but there are some ways to figure out quicker which medications are going to be best for you. But a psychiatrist might be a good idea if you're taking multiple medications, if you have a history of taking a lot of medications, a lot that haven't worked, and or are still trying to figure out which medications work for you, a psychiatrist might be a good person to add to your team. A psychiatrist is not your regular PCP, primary care physician. They may have their MD, but your regular physician, yes, might be a doctor, might be an NP, and that is someone who you see regularly for just your general medical needs. That's who you see for your physical. I was just thinking that an NP, a nurse practitioner, can also prescribe medications. So sorry if that's a little confusing. A psychiatrist, an NP, they can prescribe medications. And a medical doctor can also prescribe medications. And sometimes primary care physicians, they are MDs or they are NPs. And so they can prescribe medication. So if you have like one medication or your medications is very well managed, it's very simple, things are working well, you've, taken this medication, one or two medications, they work well. Your primary care physician, your regular doctor, they can prescribe that medication if they feel comfortable with it. Once things get a little bit more complicated with medications, that's when you might want to consider a psychiatrist, as previously stated. I recommend that you have a regular doctor that you meet with for physicals and as needed. So sometimes eating disorders require that you have regular medical follow-up. Not sometimes, they do. But it might be more frequent than an annual physical. It might be, let's run some labs and let's see where they're at in another 6 weeks. Or let's do an EKG and there was an abnormality. Let's rerun that in a month. So having a regular doctor is, I think, very necessary, whether you have an eating disorder or not. Someone that knows your medical history, someone that you can go to when you have a cold, someone that can monitor and manage your eating disorder and your medical needs associated with it is really, really important. The fifth person on your care team could be a recovery coach. So you all know that in my 5th episode, I had Meg McCabe on here. She's a well-known recovery coach. And a recovery coach can be someone that provides additional support, someone that, along with your therapist, can address your treatment goals and can address food challenges, exercise challenges, the challenges that might come up weekly or daily. Some of those recovery coaches offer tech support. Some therapists offer tech support too. But a recovery coach is another additional person to have on your team that can help you week to week or as you need. There's another note there that you get to decide how often you meet with providers on your care team. So there may feel like a standard to meet with your therapist weekly. And I would say when you're just starting therapy, that's a good idea. And you might meet with your registered dietitian weekly when you first get started. You might meet with your recovery coach weekly when you first get started. When you feel like things are more in a maintenance phase, you can continue to meet weekly, or you can decrease those meetings every other week, a monthly check-in. I often have clients that meet with me weekly, and after they've met with their dietitian weekly for a period of time and feel like things are really managed with their meal plan, they might go down to every other week or monthly to kind of check in with their dietitian. It all just really depends. And with your psychiatrist and your primary care provider, like your general practitioner, doctor, they'll tell you how often they would like to meet. So if like your meds are really well managed, it's pretty easy breezy, you might meet like every month or every 3 months to just do a check-in on your medications. Assuming things are going well medically, your doctor may say, okay, I think we're good. Let's meet in another 3 months to run labs, or let's meet in 6 months, or actually things are going really well. I'll just see you at your next physical unless something else comes up in the meantime. So it really just depends how often you meet with your providers, but it's really up to you. And if you're wondering about how often to meet with your providers, bring it up and have a conversation about it. I talk to my clients all the time about this. If you're feeling like you need to meet more frequently with a provider, so sometimes folks ask me, hey, can we meet twice a week? I will absolutely honor that for a period of time, as long as it's medically safe to do that. And then we can go back to meeting weekly, say. If you're feeling like you want to meet with your therapist every day, or your dietitian every day, or your doctor's really worried about you and wants to see you multiple times in a week, that might be an indication that you need a higher level of care. And I will always tell my clients if I feel like they need a higher level of care, if we're not managing the eating disorder well on an outpatient basis. A couple side notes to end with. So I previously mentioned in an episode that if you're in treatment, you'll have a team. And those teams might look a little different depending on the level of care. And so if you're inpatient, your team will be able to handle immediate medical needs. So you'll have a doctor who can assess your labs, maybe an EKG, and give recommendations accordingly. In addition, you might have a nurse to do weights, vitals, and disperse medications. You'll have a therapist, and likely there will be a staff dietitian who can create appropriate meal plans. Note that I am talking about an eating disorder inpatient unit. If you go to a general inpatient unit, they will not monitor meals, nor likely have a dietitian who can prescribe a meal plan. They may even do visible weights, which could be triggering, and they may not have the experience in talking about or managing eating disorders. So just to be aware of that. If you are in residential and PHP, you'll have a therapist, a dietitian, a psychiatrist, and likely a nurse or someone that's monitoring your weights, vitals, and medications. A psychiatrist is also managing your medications, but a nurse can dispense them. In IOP, you'll have probably just a therapist and a dietitian. So as you move down the levels of care, less and less support, you have less and less people on your care team. But when you're in outpatient, you get to decide who you want on your team. So you might just have a therapist and a recovery coach. You might just have a therapist and a doctor, or you might have everybody. It just all depends on what works for you. And I will tell you, as an eating disorder therapist, I will bring this topic up. Like, hey, have you ever thought about adding a dietitian? I think it might be a good idea, and this is why. Often the reason is because it's outside the scope of my practice to talk specifically about nutrition and about specific things related to food and someone's meal plan. And it's also just good having that nutrition support, typically in the beginning on a weekly basis. That is all I have for today. Then I hope it was helpful. If you have any questions or comments, please leave them for me, and I would love to hear from you. Thank you all for listening. Bye for now.
Thank you, everyone, for taking the time to listen in this week. I'm so glad you're here with me as we learn more from our wise bodies and about eating disorder recovery. For more, follow me on social media, and please share the Wise Body podcast with your friends. Lastly, if you're interested in a free client consultation, please reach out on drhughes.com. And remember, always take care of yourself and your temple. See you next time on the Wise Body podcast.